Good morning, ladies and gentlemen. So within this pandemic, we have an epidemic. That epidemic is an opioid epidemic. And Paterson, for the last 2 years, really has ramped up our efforts relative to those who are struggling with opioid use disorder. We have aggressively applied for grants so that we could create a coalition, so that we could have this opioid response team that is out on the streets engaging individuals who have been struggling with addiction. We've had hundreds of referrals as a result of this initiative, where you have 3 members of this ORT, opioid response team, an EMT, a police officer, and a social worker, primarily from Eva's Village. And then we applied for grant funding through Bloomberg Philanthropies. That wasn't easy because that was a global mayor's challenge where any city in the country or in the world could apply, and 631 did, and only 15 were selected, and Paterson was one of them. And our initiative is called Real Fix, to provide those struggling with opioid use disorder the help that they need. Well, I'm encouraged to announce that there's even more help for people in need as a result of this new initiative, where we'll have 2 social workers as a part of this collaboration with St. Joseph's Hospital in the emergency department to help those who are struggling with opioid use disorder get back on track and are on the road to recovery. As we've stated before with the pandemic, it is about recovery. With this epidemic, opioid epidemic, it is about recovery. So at this time, I'd like to call forward the program manager for this coalition, as far as the opioid response team is concerned, Andrea Ramallo.
Thank you, Mayor. First and foremost, I always really do like to give a major thank you to the current administration for being so steadfast in their dedication to understanding that this is a long-term problem that is going to take a lot of silo breaking, a lot of data concentration, a lot of consistency in our leadership and our progressive thoughts on addiction in general if we're going to make any sort of dent in the issue on the ground. So thank you, Mayor, for your dedication and keeping the consistent leadership flowing on this topic. I also definitely want to thank our department directors in public safety, fire, police as well as our Director of Health and Human Services for being so on board with really all the sort of crazy ideas that our coalition has decided to come forth with. So the coalition itself began sort of birthed from a grant in 2019 ourselves, so the Public Safety Department, Prosecutor's Office, St. Joseph's St. Joseph's Hospital, Health Coalition of Passaic County, as well as the health departments at the county and city. So we've been really blessed to really sit in data and try to understand where the gaps lying. And one of the most apparent ones became that even if we give really great information, right, about MAT, how to access MAT, even if we do something as radical as really disrupt the way MAT is delivered, which is what the Bloomberg grant does, there's so much more wraparound support that needs to go into giving an individual who's struggling with addiction, particularly also potentially struggling with homelessness, a real chance to get up and out of this cycle of just going in and out of treatment provision that may not be working for them. So that's really where we have our social workers come into the picture. And our real belief is that placing our social workers in physical spots where they're more likely to be reaching this target population is going to be critical to change. So placing them at the emergency department at St. Joseph's is huge, potentially expanding, having more hours at a wellness center or a local nonprofit who knows that they're really struggling with this population that just can't seem to get the supportive services that they need. That's our goal, to fill that gap. And I'm so thrilled that we're finally there. I cannot say more positive things about our partnership with Dr. Alexis LaPietra. She is the Chief of Pain and Addiction Medicine over at St. Joseph's. And I will let her speak to, I guess, any discussion that's happened on the St. Joe's end and why they're so dedicated to this as well. But we're just thrilled. And you'll hear from a couple people today as to sort of how this is all going to shake out over time. And thank you very much. Dr. LaPietra?
Yeah, that's fine. I was just going to say, It's always encouraging to have Dr. LaPietra with us. Looks a lot less pregnant than the last time I saw her. Congratulations. A lot less. Ladies and gentlemen, the aforementioned Dr. Alexis LaPietra, Chief of Pain and Addiction Medicine at St. Joe's Health.
Hey everybody, so it's really an honor to be here and collaborate with the City of Paterson. St. Joseph's Health and the city have been committed for decades to stopping the opioid epidemic and saving lives. People are dying, and they're dying on our doorstep, so we really have to act. People are coming into the emergency department in crisis. This program will be innovative, aggressive, and intentional in getting people into help, overcoming the many, many barriers that lie ahead of them for sustained recovery. The St. Joseph's medical team is committed. I have Dr. Nilesh Patel, our chair of emergency medicine, Dr. Santiago Batista, one of our emergency medicine residents. We are committed to using medications to decrease the death we see in this population. That's Suboxone and that's methadone. We are doing that and we're committed. But like Andrea said, there's so many other services where we don't have the bandwidth or the staff. So we are so blessed that the city is allowing us to have social workers stationed that will address case management and social services need. This is the comprehensive infrastructure that we need to actually make change. So no longer are we gonna accept the increasing death toll from the opioid epidemic. We're gonna be radical, we're gonna be a little bit crazy, and we're gonna continue to collaborate, the city and the healthcare system, to stop this thing and to show everybody how to do it, and we can really turn this thing around. It's an honor, thanks.
Very good. Yes, we're gonna get a little radical, we're gonna get a little crazy. We're gonna have a cross-boundary collaboration because we have police, we have fire, we have social workers, and we have the city of Paterson that fully supports this endeavor. That's why we aggressively pursued every opportunity to secure grant funding to address this opioid epidemic within our city and that unfortunately plagues the country. So you've heard an awful lot about these individuals. Why not hear from them directly, these social workers that'll be stationed in the emergency department at St. Joe's Health to engage individuals that want to receive the help that they need, that want to be on the road to recovery, and they'll be there at peak hours when these folks are visiting the emergency room. So at this time, I'm going to call forward Tamika Ruffin, and Ariel's going to join her too. He was reluctant.
Hello, everyone. My name is Tamika Ruffin. This is Ariel Mejia. It's a great pleasure to be a part of this new initiative to help decrease the opioid overdoses. Also, the whole initiative towards harm reduction is a great opportunity for Paterson in collaborating with St. Joe's and other agencies that provide drug treatments for the individuals.
Thank you.
Ariel, you want to add anything to that?
Yeah, please add.
It's good. Thank you.
He approves that message.
Awesome.
That's it.
Full faith, guys.
Yeah, sure.
Can you guys just talk about the obstacles that you guys deal with on a daily basis as social workers dealing with this epidemic here in the city?
Well, more so, it would be the educational aspect of providing those, providing the education to the patients. I think that, and also being understanding that it might not be their time at that time to receive the treatment. So I think that's more the hurdle to get past, as far as just them wanting to get the help. So.
And what are you seeing on your end when it comes to just demographics? Is it more single women, single men, parents, family? Who's seeking help in the city?
I think it's, from my experience, it's both.
Both men and women.
Yes, men and
all
women.
races. It could be white, African American, Latino. Everyone needs help, and there's a huge problem here in Paterson, and we just need to do our part to, fix the problem.
This young lady is very eager to contribute to the conversation.
Hi, I'm Coco Pearson. I've been here since as of November. I've been dealing with the individuals so far from opioid response team. What I've encountered so far is some of them, they're not ready for treatment. but I just meet them where they are. So if they're, currently want to work on other things, maybe getting assistance with applying for SNAP benefits or looking for housing, I start with them there. But when I do have these interactions, I am bringing back up the topic about where they are, if they're ready for treatment. And some of them, they're in need of other things. They're coming in beat up, needing money. Even when we're trying to get them in certain places, they may need assistance getting there. So I'm trying to find programs that help pick them up and stuff. So that's where we are. And the demographics, yes, a lot of them are individuals. I do have a couple. Sometimes that could be hard, because if one relapses, the other wants to. So trying to work with them individually, but keep them together if there are a couple. So that's it.
Thank you, Coco. I just wanted to say your name. That's why I said thank you. So as you could see, to put everything into perspective relative to this epidemic, I've often cited an example when our fire department was featured on A&E's Live Rescue. It's an hour-long program. Our fire department administered Narcan 12 times within that short segment, and we're not even featured for the entire 60 minutes. So that puts into perspective what we're up against. But we're not sitting on our hands, right? This is all hands on deck. And we feel as if the efforts we're taking will have a positive impact, not only on Paterson, but those lives that have been adversely affected by the opioid epidemic. Thank you for joining us.